We have massive inequality in the South African healthcare system. We have overcrowded and underfunded public hospitals. We also have a private healthcare system that is operationally efficient, but is deemed often to be too expensive and at the mercy of powerful medical aid companies.
Well, in the public sector, we firstly have the challenge of a high burden of disease. So what I mean by that is a high burden of HIV and AIDS, TB, non-communicable diseases such as diabetes, hypertension, etc. In addition to that, we're also a society that has high levels of interpersonal violence. So given that quadruple burden of disease, as we call it, which is very different from many other countries, we need to change the health system around to prevent many of these things from happening. So in the public sector, we have challenges around quality, from long waiting times to attitudes of staff, to drug stockouts, to infection control, etc. So we need to turn that around. In the private sector, as Jeremy mentioned, the quality appears to be less of a problem. However, that hasn't actually been assessed, but our interaction with the system seems to suggest that that's the case. But the costs are astronomical. And moving towards universal health coverage, which is a United Nations stated goal for all member states, that they should move towards that, would provide an opportunity to have a single fund in which government would be able to buy services on behalf of all citizens in a manner that's equitable and be able to then manage the resources much more efficiently than having a public system which is basically having quality challenges, a private system where each of the individual medical schemes attempt to buy services on behalf of their individual members, and the consequence of which is that there's quite a lot of inefficiency in that system.
I really think he's made the case for the health reasons why we need a universal system, in this case an NHI. I would also argue that there's also a socio-political reason, and then the truth of the matter is that South Africa simply is not going to be in a position to sustain a viable democracy in the context of these gross inequalities. South Africa is not going to be able to build a stable democracy in the context where quite clearly the inequalities and the failure to access good quality health care speaks to the failure of one of the fundamental pacts that is our constitutional dispensation, which is really about the restoration of people's dignity. So that case to me is very clear. I think what is far much more difficult is far much more to understand the move from the original conception of how that was going to be achieved.
The analogy that I would use is if your market is, if your market is in Sandton and that's where 80% of the value of the market lies, you're naturally going to put in 80% of your resources. In healthcare, however, you've got the reverse that applies. So it's a disproportionality. It's a skewing of resources. What national health insurance is about, I think it's firstly a term that defines many things, and we'll probably get into the definition later. But what it does is, in my mind, it seeks to address that disproportionality in resources, and it seeks to give cover, appropriate cover, to those people that are presently receiving less cover than that.
Providing it is well regulated, providing it is well managed, and providing we don't have issues of corruption.
The current system is probably not sustainable going forward. I have not seen anything in my environment that is saying that the current healthcare financing system is sustainable going forward. If I zoom into the healthcare financing of the private healthcare sector, that is made up of 97 medical aid schemes who collect about 107 billion rand a year and pay up about 94, 95 billion rands, up to about 90% to healthcare. It's questionable whether spending that amount of money is yielding the outcomes that you would expect from those who deliver healthcare services. Now, there's a lot of fragmentation as well in the current system. What NHI does, I think it's pulling together the resources that are there in this country. You have 107 billion rand in the private sector, pocketed in 97 medical aid schemes. That's fragmentation. So you can't use that scale to to attract reasonable tariff from those who provide health care, so as to have a knock-on effect on your contribution. And then on the public sector side, as Stavros is saying, you have another 110 billion rand servicing the rest of the population, but then there you have huge problems of human resources, etc., etc., etc. And then if you look at the 220 billion rand that is spent on healthcare in this country, and look at the outcomes, that's about 8.5% of GDP, and look at the outcomes are very bad. There are countries who are doing better than us, spending less money on healthcare than us.
Dr. Pillay, what is that change? What is that one fundamental change, in your opinion? Let's park the theory now. We've got the theory, we will return to it. But I'm looking, and we've seen the dichotomy that exists in this country. On the one, and I want you to try and illustrate it for me in terms of somebody who is living in a rural area in the deep Eastern Cape and someone who is living in a townhouse in Parktown North. What is the fundamental change, the positive change that it's going to bring to their lives once this thing has rolled out properly?
Well, it would mean for somebody that's living in a deep rural area that he or she would be able to access care from providers that are within his or her vicinity, particularly private providers that previously were not there. If there is a
providing those caregivers exist.
Sure, yes. If they don't exist, the public system will certainly have to be beefed up. And I suppose the 40% of people that have responded now would probably increase if we improve the quality of care in the public sector. And I think that's the tipping point for the NHI. The public sector needs to improve its quality so that people have confidence that this NHI that we're going to enter into is going to deliver the quality of services that those that have access to the private sector can now have confidence in. And I think that's the challenge to us as a department, to make sure that that happens. We're trying to design an entitlement system and an NHI that would allow households to have access, but not necessarily put them into a financial burden worse than what they
But truth be known, and I will come to the rest of the panel, you don't know at this point what that entitlement system is going to look like. The true viability of the National Health Insurance Scheme will be tested in the government's ability to improve the delivery of medical services to the general public. The position that we have right now is that we're not getting that right. By your own admission, from the government side, Dr. Pillay, it's a shambles. That surely we should be looking at improving quality health care first before implementing the NHI. We're putting the cart before the horse, aren't we?
Well, Jeremy, I mean, let me make a bit of a provocative statement. I think the big strategic error that we've made in the health sector, and I can say that because I was in the Department of Health for a long time, is to assume that because the focus was so much on the public health sector, we never anticipated, if you look at the late 90s, the private sector was not this size then. So there's a sense in which the private sector, people thought it was going to remain small, restricted, and the focus was on the public health system. The reality of today is that a lot of the resources are in the private sector, human resources. So the strategic error that we've made historically is not to come to terms with the reality of the coexistence of the two systems and build bridgeways to connect the two systems. So what we've had in South Africa, unfortunately, is the development of two parallel systems. And they are not, the benefits and the strengths of the other don't feed into the other. And I think the NHI, for the very first time, provides a possibility whereby government, in a sense, the fundamental premise is that the two systems have to coexist, have to work together.
But it's going to be impossible, surely, to try and reverse that. Surely those two positions, that lack of coexistence has now become too entrenched.
I think if we don't do anything, Jeremy, the situation will be worse and
so the gap gets wider.
The gap gets wider.
NHI has become almost like a panacea to solve all the problems in the healthcare system. To some extent, all other policy processes are now on hold, NHI is going to solve all the problems in the health system. Somehow, as you say, sir, it's a magic bullet that is going to fix the weaknesses. It's a question of reprioritization, and recalibration. Humphrey, pick it up. Would you like to answer the question? Thank you. Good point.
Yeah, the approach has to be far more comprehensive than that. You can't just zoom into one issue and think that systemically you're going to solve the problem. The HIV/AIDS issue is one, the TB is one. It's much more comprehensive than that. For instance, you're talking about 220 billion rand in the kitty. You say splashing it around. I would argue that the 214 billion rand is splashed around now and we've got bad outcomes. Because that 220 billion rand is not pooled anywhere, where now that healthcare financing for the 50 million people in South Africa is prudently used to buy healthcare for everybody. It is splashed over there, it's in fragmented pools, and we're not getting the outcomes. And as I said earlier, we can continue with what we're doing. It's not sustainable going forward. The medical scheme industry is not growing. There are problems within that industry, they're falling off. Take NHI out of it. So the pathway that we're on in South Africa right now, there are problems in the public sector, there are huge problems in the private healthcare sector. So we're not going to achieve what we achieve until we make major changes. And the NHI, what it's trying to do from our understanding, is trying to see how can we pool the healthcare finances in South Africa. How can you pool that 210 billion rand and see what kind of healthcare we can buy so that we can improve the outcomes?
What we need to do is, firstly, let me state, Jeremy, that the private sector is not without its imperfections. I think we acknowledge that. Certainly, it's a more perfect system than what exists in the overburdened public sector. So you kind of have a private sector that's up here and a public sector that's down there. And I think the challenge here is, how do we equalize this so that all 50 million people that live in South Africa can access a facility anywhere, anytime, that is of a reasonably equivalent standard. So I think for me that's really the first thing that NHI is about. Now to get to that level, as Dr. Ntsaluba said, you have to leverage some of the resources that reside in the private sector.